Hello friends, so today we are going to talk about the common ECG abnormalities, and to understand the ECG abnormalities, first of all we have to appreciate the normal ECG pattern, and this is the normal ECG pattern. P wave, QRS complex, T wave and the small U wave. The normal heart rate will be 60 to 100 beat per minute. After that we will discuss the sinus bradycardia, and for this we will compare the sinus bradycardia waveform with the normal ECG pattern, and in the sinus bradycardia the R to R interval will be increased and the number of R waves will be lesser than the normal ECG pattern. In the bradycardia the heart rate will be less than 60 beat per minute. After that torsades de points are also called twisting of the points. We will also compare this with the normal ECG pattern, and in the torsades there will be no normal QRS complex but will be abnormal QRS complexes, and there is also a waxing and waning of the QRS complexes. The causes of torsades are magnesium deficiency, potassium deficiency, and they can also be seen in the chronic alcoholics ECG pattern. And there is also a asystole. In asystole there is no P wave, T wave or QRS complexes, and when we compare this with the normal ECG there is a flat line. That's why asystole is also called flat line. The causes of asystole is heavy blood loss, heart rate, heart attack, electrolyte disturbances, trauma and the pulmonary embolism. After that the atrial flutter, and in atrial flutter there is no P wave, but instead of the P wave there will be sawtooth appearance of the P wave, narrowing of the QRS complexes, and the R to R interval will be remain same and the rhythm is regular. The heart rate will be 250 to 400 beat per minute, and the causes of atrial flutter are heart failure, valvular disorder, cardiomyopathy. We will discuss the atrial fibrillation, and this we will compare the atrial fibrillation pattern with normal ECG. There will be no P wave, and instead of P wave there will be fibrillatory or F waves which are present before the QRS complexes, narrowing of the QRS complexes, and the R to R interval will not be same which were same in the atrial flutter. And the causes of atrial fibrillation is myocardial infarction, hypertension, hyperthyroidism. The heart rate in the atrial fibrillation will be 350 to 600 beat per minute. And ventricular fibrillation. And ventricular fibrillation, there is a famous type of mnemonic which is a very funny type of waves, as there is no P wave, T wave or QRS complexes. The heart rate will be 300 to 400 beat per minute, and the causes of ventricular fibrillation are coronary artery disease, electrocution and acute coronary syndrome. Then is the ventricular tachycardia, and to memorize the ventricular tachycardia waveform there is also a common mnemonic which is very tidy waves, as we can see that there is no P wave and T wave, and the QRS complex is very tight as shown in the figure here. The heart rate will be 120 to 250 beat per minute, and the causes of ventricular tachycardia are ischemic heart disease and cardiomyopathy. Number 9 is the STEMI, also called ST segment elevation myocardial infarction. And the ST segment elevation myocardial infarction, there is the elevation of the ST segment as shown in the ECG pattern, and the causes of STEMI are electrolyte disturbance, left bundle branch block and ventricular hypertrophy. And there is the two cases of potassium disturbances. First of all, the hyperkalemia. In the hyperkalemia there is no P wave and wide QRS complexes. We can compare this with the normal ECG, and the tall and tented T waves. The causes of hyperkalemia are renal failure, rhabdomyolysis, metabolic acidosis and drug like spironolactone. And the last one is hypokalemia. In the hypokalemia we will compare this with the normal ECG pattern, and there is the prominent U wave, ST segment depression, and the PR interval is increased. The causes of hypokalemia are alcohol use, chronic kidney disease and the diabetic ketoacidosis. Thanks for watching.